Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. I'm a board-certified psychiatric nurse practitioner trained at the doctoral level with over 13 years of nursing experience in the hospital. And I'm really happy that you've joined me for this channel and so that I can answer some of your questions live. Remember, we're also on Facebook, Instagram, and Twitter for additional content. Those will be linked in the description. And please like and subscribe to the channel. Liking and subscribing to the channel really helps me out as a content creator. And that's one of the reasons why I have been able to be a part of YouTube Health. A couple things you should know. The first thing is that I am not feeling very well tonight. So if for some reason I need to cut this short, I might do that. And if I haven't answered your question, I will get to it next week. The other thing is that YouTube likes to update things all the time, and my chat looks a little weird. So if I'm having any trouble, I will let you know. So I'm going to go ahead and get this started. But if you guys have any questions, please feel free to put them into the chat. Okay. So we had several medication questions this week, which is actually kind of awesome. I like answering medication questions because I think it's really important for people to get good education on their medications. So one of the most common places that I get questions is my antibiotics video that I have. So the first one said, my wife is 10 weeks pregnant. She has a urinary tract infection and typhoid. So the doctor gave her amikacin, and ceftriaxone injections. Will these injections hurt my baby? So this is a good way to start, guys. So one of the first things we need to talk about is antibiotics in general. So antibiotics are designed to kill bacteria. They do not kill viruses or funguses or anything like that. They kill bacteria. And you can imagine that an antibiotic is kind of like one army, and on the other side is bacteria. And this antibiotic comes in, and its job is to kill off this bacteria. Now, the thing is, a lot of people will stop taking their antibiotic in the middle of its course. And that's because antibiotics help you feel better really fast. Like within 24 hours, a lot of people start to feel better. Now, if you start to feel better, that doesn't mean the bacteria is gone. All it means is that you've killed off a lot of it, but there's still a lot of bacteria in the back. And what these guys are doing is they're watching how the antibiotic works, and they're building up a resistance to that. They're building a wall. And then they're bringing in reinforcements. They're bringing in more bacteria. So now, a couple of days later, you stop the antibiotic because you didn't want to take anything that might hurt the baby. And now you're feeling bad again. So you're like, oh, I guess I better take the rest of it. But then here's what happens. That antibiotic can't get past the wall because they built a defense. And so now you don't get better. And that makes it harder for us to treat your bacterial infection. And we end up needing to give you stronger and stronger medications. That is antibacterial resistance. So it's really important that if you are given an antibiotic and you choose to take it, you take it all as prescribed. Okay. So now, one of the medications here is called ceftriaxone. Ceftriaxone is very commonly used during pregnancy. It's used for a lot of different infections, including sexually transmitted diseases. So we really do use it a lot, and it is considered safe. Amikacin, however, is not something that's used here in the United States. Now, part of the reason why it's not used is it's actually contraindicated during pregnancy. So this is where we get into the next piece of this education. Why do I know this stuff? How do doctors and nurse practitioners and pharmacists, how do we understand this stuff? So we can't do studies on pregnant women or breastfeeding women. It's not ethical because we can't put babies at risk. So all we can do is gather data from a whole bunch of different sources. There are a lot of maternal reporting lines where if a mom is exposed to a medication, providers can report that so that they can go ahead and we can gather data that way. We also have a lot of other information. So one of the sources that I use is Thomas Hale's book. He runs the infant risk line, and he's created this like rating scale, and he rates both pregnancy safety and lactation safety of medications. So Thomas is a pharmacist, and so what he's done is he's aggregated animal studies, he's aggregated some of this human data we have, he's aggregated studies on adults who are not pregnant and the safety of medications, as well as half-life, molecule size, fat solubility, everything. And he's able to take all this information and create a risk scale. Amikacin is contraindicated during pregnancy. And so what it says is there's no studies on it. However, this is in a particular class of medications called aminoglycosides. I want to make sure I say it right. And so these medications have the potential to cause different types of birth defects, including issues with the kidneys, ears, and nerves. So it is very possible that this could cause issues. Now, every medication is risk versus benefit, and there are no studies. What I can tell you is typhoid is not here in the United States. This is not something I encounter. And typhoid is a very serious infection. And if left untreated, it has as much as a 60% risk of miscarriage. And so this is why it's so important to treat this infection. And pregnant women are at higher risk for developing typhoid. I am not sure, but amikacin may be the most effective treatment for typhoid. So when you're going to get these medications, you need to speak to your healthcare provider and you need to say to them, what are the benefits and what are the risks if I choose to take this medication? They're required to tell you that. If you're not sure and you need a second opinion, one of the places you can get a second opinion is your local pharmacist. Your pharmacist has specialized training in medications, and they are able to give you more data on the safety and effectiveness of those medications. So that is a really good question. And I see the question in the chat, but before I answer that, the other question I got on the antibiotics video was, I'm 31 weeks pregnant and I have a UTI. My doctor suggested Norflox 400 milligram tablets. Is it safe or not? So that particular antibiotic is not used here in the United States, so I can't answer the question definitively. But what you can do is exactly what I just said. You can go to your local pharmacist and they can help give you some more information on whether that is an effective medication for a urinary tract infection and its safety profile during pregnancy. Hi, Bern. If you have gestational diabetes, does it go away after you give birth? And if yes, how long till your blood sugar goes back to normal? Is there a reason why some women have gestational diabetes? Okay, I love this question. Gestational diabetes is a very, very complex condition. Once you have gestational diabetes, you are at a much higher risk of developing diabetes afterwards, and that is real type 2 diabetes, okay? So some women will continue to have issues with their blood sugar as soon as they give birth on. They never are able to kind of manage it, and they're converted into a type 2 diabetes diagnosis. Other women, within about 4 to 6 weeks, their blood sugars will normalize. Some women will normalize as soon as they give birth. And those women can then go on to never have diabetes, or 6 months or a year later or longer, you might develop diabetes on your own. So it's hard for us to say. Now, why is it happening? It's really probably due to insulin resistance, but there's a lot of changes that are going on in the pregnant woman's body. And it is happening so rapidly that sometimes the organs just they can't quite keep up. It's very common for us to see women develop hypertension like early in the pregnancy, like around 12 to 15 weeks. That's not common for a woman who has gestational hypertension or gestational high blood pressure, right? we usually see high blood pressure related to pregnancy in the second trimester, even into the third trimester. So when you're talking about early second or even first trimester developing blood pressure issues, that's just not something that's usually associated with pregnancy. But these will be women that up until that time had normal blood pressures. What we think is happening is they probably had normal intermittent blood pressures, but they were actually in the process of developing hypertension on their own, and therefore they just converted during pregnancy. Same thing with gestational diabetes. Generally speaking, women who are showing up with gestational diabetes do not eat a good diet. It's usually high in carbs. They are oftentimes overweight. A lot of people with PCOS, polycystic ovarian syndrome, and I have a video on that, I believe, they can also develop, they're more insulin resistant, and that can lead to gestational diabetes. Now, here's one of the things that I'm going to tell you guys. Everybody, when they get diagnosed with gestational diabetes, they're very upset and they just want to control it with their diet. I'm going to tell you, I don't believe in controlling your gestational diabetes with diet. The risks of gestational diabetes are significant, okay? One of the biggest causes of a late term fetal demise or fetal death in the belly is diabetes, okay? Diabetes destroys the placenta, and the placenta is no longer able to function properly, and therefore the baby doesn't get the proper blood flow right at the very end, and this can be a huge issue, including the possibility of causing death. So a lot of times, women with gestational diabetes, we have to deliver early. So the placenta, what it is it's like the placenta is this organ that feeds the baby. It's full of blood vessels, and these blood vessels kind of harden, and then there's just no transfer. Now, the other thing is gestational diabetes gives you a big baby. Why? Because your blood sugar is not under control. So not only do you have too much blood sugar, but your baby does. So these babies are often born huge, 11 pounds, 12 pounds. But here's the thing. Imagine this baby's been getting so much sugar that its blood sugar caused it to gain weight, right? And then your baby is born and that sugar source is cut off. These babies, 9 times out of 10, end up in the neonatal intensive care unit receiving extremely intensive care because they can't control their blood sugar and their blood sugar is plummeting. So we have to give them IV drips of sugar just to help them get back in balance. Gestational diabetes, in my opinion, is best managed with medication, and that medication is insulin. We're also used to hearing our friends and family take pills for their diabetes. But unfortunately, during pregnancy, you're changing so fast that your body doesn't have time to be able to utilize pills the right way. Insulin is the fastest, best way to get your sugar under control fast and keep it under control. The other thing is that it's really important to eat the right diet. And I'm just going to tell you guys, I have been absolutely floored and appalled by some of the education that I'm hearing women come to me about their diet and what's good when they have diabetes. So I would tell you, make sure you're doing your own research as well. I had a woman come to me the other day. She's pre-pregnancy. She's trying to become pregnant. She's been having some fertility problems. They think it's related to her weight and insulin resistance. And they think she's like borderline diabetic. So a nutritionist told her that one of the things she could eat is white rice. So for those of you who aren't aware, white rice is pure sugar. That's all it is. It's just carbs. White rice only serves a purpose if you mix it with beans. If you put white rice with beans, the two together create a protein. But separately, they don't either one of them don't have the right amino acids to create a protein that our body needs. So instead, white rice on its own is just sugar. It's just a carbohydrate and it's no good for you. And this is one of many things that I hear people being told to eat that's not very good. Another one, in case y'all weren't sure, oatmeal. Oatmeal is pure sugar, guys. It is not a healthy food. And you guys, I'm sure, will say over and over that this is something you hear. It's good for your heart. It's good for whatever. It is not. I have a video on keto. The keto diet is a low-carb diet. I think it's very, very good for women who have gestational diabetes. And I think it's important for a lot of women to understand what a low-carb diet actually looks like. I was recently in the hospital like a couple weeks ago for like a bug bite that had a little bit of an infection, right? And so an infection, when you guys are sick, UTIs, pregnancy is a good one. Any sickness, your body usually needs a lot of protein to heal. Protein is essential for tissue healing. So the next day I get like served breakfast, and the breakfast tray was nothing but sugar. And I couldn't even believe it. I had juice and I had sugar for coffee and I had pancakes and I had all this stuff. And I was like, oh my gosh, this is just nothing but carbs. And this is what, unfortunately, we're being told is healthy for us. And it really isn't. And that was coming from a hospital. So I just want you guys, there's my cat, say hi to Figs. So I just want you guys to know that that's one of the things that you should be aware of. And Bern, if you have any follow-up questions, please feel free to put them onto the chat. Going along with that, I actually have a superfoods video or gestational diabetes video. And the person said, why not tea? Tea doesn't have sugar in it. And so I think that the way I worded the video was a little confusing. So I was glad this person questioned this. So like right now, my favorite thing in the whole wide world is iced tea with no sugar. I love black tea. It's great. Black teas, green teas, really good for you. If you are pregnant, avoid any other herbal teas. Do not do any other teas, guys. You want to stick to the basics. In our country, at least, and probably a lot of the other countries from my viewers who are here, please feel free to shout out where you guys are from. A lot of countries do not monitor vitamins, supplements, and herbal kind of stuff. And teas fall into the herbal category. They're made of herbs, right? And so if it's not being monitored, you don't necessarily know what herbs are in that packet. So straight basic like green tea and black tea is good. But for example, one herb that's very bad for pregnancy is black cohosh. That is not safe for pregnancy. And so you wouldn't want there to be any black cohosh in your tea. So if that factory that tea is being made from isn't being regulated, then you don't know actually what's in the tea bag, and you could be ingesting something that's not good. One of the things I tell people, a lot of people ask me like, what's the safest tea? Literally the one that everybody buys, like Lipton, a basic, like regular, like millions of people buy, because if it was killing people, we'd know it. The organic fancy stuff, guys, is not always the best. Okay. Going back to tea, that person's correct. If it doesn't have sugar in it, it is usually okay for you to drink. The only thing I would say is be careful of caffeine. There is a limit to caffeine. You can have some, but you don't want to overdo it. But basically you want to avoid anything that's got a lot of sugar in it. Okay. Sugar is not good for your diabetes. Now, I will say this about artificial sweeteners. Everybody's kind of on the fence about artificial sweeteners, especially when it comes to diabetes. Artificial sweeteners, they've done like research here and there. There's some that are safer. There's some that are not as safe. So you definitely want to know that. But the artificial sweeteners do create an insulin response in your body. And they are not as friendly to somebody who has diabetes, okay? Now, I'm not promoting sugar. Sugar is not good for you either. You kind of just have to go with unsweetened. But those artificial sweeteners, when your tongue tastes the sweet, it starts the same insulin process that it does for sugar. And when your body's misusing insulin, then you store the sugar as fat, and that's what causes diabetes, and that's what causes you to have higher blood sugar. So you want to kind of stay away from that. I hope that answers your question. I'm going to stick with meds for now, because if you guys notice the first two questions on antibiotics, those both mentioned a urinary tract infection. So now I have two questions on my urinary tract infection videos, which both kind of have to do with medications. So I'm in my 7th week of pregnancy. Last night I had acidity, and after being intimate with my husband, in the morning I had so much pain and burning in my vagina. I consulted the doctor, and she told me it's a UTI and gave me Cran Max sachets. Now I don't feel feel well. My back pain has started and I have white discharge and fever. What is happening? Is my baby fine? So, love this question. Let's go into urinary tract infections. So, you have a bladder and the bladder leads out right near your vagina with this little tube that's called a urethra, and it's really, really small. The urethra hole is below your clitoris and above your vagina. Now, that little hole, it's a tiny short tube, okay? And so the reason why women are always told to wipe front, which is the clitoris, to back, which is the anus, your butt, is because if you wipe from back towards the anus up, you can actually wipe some of the bacteria from your bottom up into the urethra. Now, once you get bacteria there, it gets to climb up and then it goes into this bladder. And the bladder is dark and warm and moist. And when you have urine in there and it sits in there too long, it can grow and grow, developing into an infection. Unfortunately, when you're pregnant, oftentimes you can't empty the bladder fully because the baby kind of compresses on it and then it ends up holding in urine. So the other thing pregnant women like to do is they don't like to drink enough. And because they don't drink enough, they end up not flushing things out well enough, and then they end up with the infection. There's a lot of people out there that say you can treat a urinary tract infection with cranberry. Now, the cranberry max, like sachets and stuff, I'm not familiar with that particularly, but I did look them up. They appear to be a cranberry pill. So the cranberry pills, this is what they do. They acidify the urine. They make the urine more acidic. And if the urine is more acidic, then it is actually going to prevent or inhibit the growth of bacteria. But once you have bacteria already established, it's not going to do that anymore, guys. Once the bacteria has grown into an infection, you need something to treat that. The other thing that's commonly used is mannose and D-mannose. And D-mannose is used, and what it kind of does is it kind of like makes the walls of the bladder not sticky so that the bacteria can't stick to it and sit there and grow, right? So one of the things that happens because of that is that also can prevent, but it's not going to cure an infection that started. You need antibiotics. Now, going to this person, I think the reason why you didn't feel well is because I don't think it treated the infection and you got worse. So now she says back pain. So here we go. You have a bladder and then you have two ureters. Urethra is going down, ureters. Okay. These are also little tubes and they go to your kidneys. Women who are pregnant are immunocompromised. They have a much higher risk of developing infections. That's why we encourage all the different immunizations, like for the flu and stuff like that. So you're also at risk for infections like urinary tract infections, and left untreated, you're at risk for pyelonephritis. Pyelonephritis is a kidney infection that comes from a urinary tract infection that's left untreated. So it's one of the things that you can do is you can, when you have this, is it can cause sepsis. So sepsis is a blood infection, and when left untreated, it can cause organ damage. Once you have sepsis, this blood infection, we have to deliver the baby. It's almost considered a medical emergency because the sepsis, when it's in your blood, well, imagine your blood is feeding the baby. So it's going to go through the placenta to the baby, and that can be life-threatening for the baby. So this is why it's so important, guys. Urinary tract infections are serious infections. It's not like when you are not, when you're not pregnant. A lot of us take them for granted, but you need to actually get them treated right away when you have them. I can't tell you how many women I saw who went into preterm labor because of that. So then I had another question on urinary tract infections, which I think is going to kind of finish up our medication questions. I'm 2 months pregnant, facing a urinary infection, pelvic pain, leg pains, and back pain. What should I do? I use canastatin cream and mefenamic acid tablets but there's no result, okay? So the I'm going to say it wrong, methanoamic acid, I cannot comment on. That is not something that I use here in the United States. I have heard of something that I think is very similar, which can be used and is similar to the canistatin. Canistatin, though, is not for bacteria. Canesten is for a yeast infection. It's a fungal cream. So this would never treat a urinary tract infection, guys, just so you know. And it's very important that you guys know what you're using and make sure you understand what they're treating you for. So Canesten is considered safe for use if it's topical or vaginal. If it is given to you oral, a tablet, it is considered probably safe, but there are a few more risks. So the preference when you're pregnant is to use it topical or vaginal. This treats a yeast infection. It will not treat bacteria. So if you were given this for a urinary tract infection, your urinary tract infection would get worse. But as far as using it, it can be used during pregnancy. If you guys get a yeast infection, it's very important that you don't self-treat. We need to swab. So what we do is we take a sterile Q-tip and we swab the secretions and we send it off to a lab. And that lab can tell us what we're dealing with: bacteria, viral, fungal. Is it semen? Is it urine? It can tell us what we're looking at so that we can make a determination as what the breast treatment for you is. Hi, Natalie. Can you breastfeed while pregnant? The answer is yes, unless there's something going on. So breastfeeding during pregnancy has happened for millions of billions of years, and I have a video on it. So there is a couple of things you need to be aware of. So first of all, the reason why a lot of women are told they can't breastfeed is because of a risk of miscarriage. So why is that even a thing? So there's a hormone called oxytocin. Oxytocin is the love hormone. This is the hormone that causes us to have the feelings, like the vibration-y feelings that we have when we have an orgasm, because it's causing uterine contractions. Okay, this is also what causes uterine contractions when you are giving birth. So Pitocin is the man-made version of oxytocin. And so that's what causes the uterine contractions that help you dilate. And then finally, oxytocin, as far as breastfeeding goes, is the milk ejection hormone. So it's the one that says, send the milk out, okay? So you need oxytocin to breastfeed. But what happens is when you're breastfeeding and that oxytocin is stimulating the milk to come out, it also can cause uterine contractions, okay? And so if you're at a higher risk for possibly having a miscarriage, your doctor is going to try to discourage. Higher risk for miscarriage could be history of an incompetent cervix, bleeding, having more than one baby, all this different stuff, right? Now, that being said, let's say we're good to go. Can I breastfeed during pregnancy? Well, there's one other consideration that's very serious. So you're cleared to breastfeed, you're going to do it, everything's going well. Well, when you're pregnant without breastfeeding, around the 6th month, your body starts to produce colostrum. That's that first milk, that thick, sticky milk that's designed for a newborn. And that starts around 6 months. A lot of people don't know that, but like a lot of women will start to see leaking and stuff in the 2nd trimester. Okay, so what can happen when you're pregnant and you're breastfeeding is this. You can have this full milk supply. Everything is fantastic. And then all of a sudden, it switches to colostrum. Now, this doesn't happen to everybody. So if you hear somebody say, oh, no, I breastfed with no problem. Yes, they might have. They absolutely might have. But some women, all of a sudden, their milk will dry up and they're on colostrum. And you don't always realize it because our breasts do get heavier during pregnancy anyway. So then they don't realize they're not making milk because the baby's eating and stuff. So you have to monitor your baby's weight and their output. You need to make sure they're peeing and pooping enough and that they are still gaining weight. They're not losing weight or stuff like that. If you're not sure about it, if you are not sure what's going on with the baby or your instinct says the baby is not eating well, you need to get them checked out by the pediatrician to see if anything's going on, and you might need to switch to formula. I hope that answers your question. So, actually, I have one other thing about breastfeeding. If you are, this is called tandem breastfeeding, right? So if you breastfeed throughout the pregnancy and you get to the end, baby has delivered, the one other thing you need to make sure is that the newborn is prioritized first, okay? You have to make sure your newborn baby gets the priority milk always. If the other baby needs to eat, you either eventually learn how to breastfeed them both at the same time, or new baby first and then your older child. The other thing is, if you are breastfeeding two kids, a toddler or an older baby and a newborn, you need to make sure you switch breasts, okay? You cannot have one baby using this and the other baby using this, because your breasts produce differently. I mean, every woman who's breastfed alive will tell you that. One produces more than the other, et cetera, et cetera. So if you have each one eating on only one breast, they might not be getting the same amounts or the same quality milk. So you want to make sure they switch. Okay. I hope that answers the question. All right. So we had a couple questions on kind of like on bleeding. The first one was in second trimester bleeding. So it said, I'm 24 weeks pregnant. Today I saw some pinkish reddish bleeding with no pain. Now I'm fine. I also had an anatomy scan. She said anomaly, but I know it's an anatomy scan is what we call it. Last week. All things were going fine, but I am worried. I've already had 2 miscarriages at 12 weeks. Should I worry? Okay. First trimester bleeding is a lot more common than a lot of people realize. It is really super common. There's so many reasons why you can bleed in the first trimester. I'm not saying it's not scary and you always want to get it checked out, but there are really legitimately a lot of things that can happen that will cause that. Second trimester is a little bit more tricky. So in the second trimester, we do start to get worried when we see bleeding, because there are a lot less causes of it. And a lot of the causes are an indication that something's going on that we need to work on. It's usually a problem. If there's second trimester bleeding, we usually assume problem. Could be a placenta issue, like the placenta is kind of coming off the wall a little bit. Could be an infection. When you get an infection, you'll have some bleeding. It could be, you're dilating. I'm like, it's in my head. It could be that you're dilating. So as the cervix, if this is your cervix, as it starts to dilate, that kind of pulling apart can cause some bleeding. So there's a lot of different reasons. So you need to get checked out. You go, you get your ultrasound, and that can sometimes reveal the cause of the bleeding. But honestly, guys, sometimes it can't. Sometimes we never know the reason. If you are spotting or bleeding during your second trimester, if you're spotting or bleeding during any trimester of your pregnancy, you need to get checked out. Your healthcare providers are being paid a lot of money to work 24/7, and that's what they're there for. So if you have any bleeding, please call so they can tell you what they want you to do next. Now, for our second trimester bleed, I want you to call. I want to make sure you're getting that checked out. Is it okay that you're worried? It's understandable that you're worried. However, everything could be fine. And the way to know is to let your healthcare provider assess you. Okay? Any of you who are joining me, welcome, welcome. I am Dr. Samantha, the maternity mentor. I'm answering questions, but just so you guys know, I'm actually on my last question. So if you all have any questions, you better put them in the chat, because otherwise we're going to have a short conversation here. Okay. Kind of in our same venue, which is Placenta Previa. So how about dark red bleeding and Placenta Previa? I'm a little concerned because it says it's bright red, but mine is dark red. Should I be worried? Okay, so this is great. This is a great question. I have a video on the colors of bleeding, and I can see why that would be a little bit confusing. So pink is spotting. Pink usually means you have fresh blood that's mixed with something else. So it could be normal mucus, it could be urine, it could be semen, it could be like discharge from an infection. It's usually blood mixed with something else, but of course the blood is very small in its amount. So that's why it's pink. Then you have bright red. Bright red is bleeding. You are actively bleeding, and that's why it's bright red. Then you have brown. Brown is old blood. This is usually a sign of bleeding that has resolved, and you're getting the old bits of blood coming out at that point. Dark red is the in-between. It's in between bright red and brown. So it's usually this transition type of period where your bleed is resolving and then it's going to get better, okay? But with placenta previa, we do handle that very carefully. So a placenta previa, your placenta full of blood vessels, is supposed to attach to the side of the uterine wall. And when it does, the uterus has a whole bunch of blood vessels, and this has a whole bunch, and they go together and they create this bed that there's an exchange back and forth to feed the baby and get rid of toxins. So the placenta previa is when it goes over the cervix. So here's your uterus, here's your cervix. A placenta previa complete means the placenta is completely over this. Now remember, your cervix has to dilate. So when you have a placenta here and it dilates, now it's open. Well, this is all blood vessels. So if this opens like this, you're going to bleed out and the baby's going to bleed out, and it's a medical emergency. So most women with a complete or a partial means it's kind of half covering, are required to get a cesarean section delivery. We usually actually do it around 34 weeks because we don't want there to be any chance that they start to dilate due to Braxton Hicks contractions, because that is a medical emergency. Now, if you have a low-lying or marginal means it's kind of right next to it, that is a possibility to have a vaginal birth. So depending on your placenta previa, if you have like a partial, it's possible that just a tiny bit is seeping out, but you definitely want to have your healthcare provider check you out. And we almost always do an ultrasound for that. That was the last question, other than I'm going to start answering whatever's in the chat, guys, just so you know. Hi, Natalie. Okay. Is a first pregnancy birth any indication of how a second one will go? That is a good question. Okay. I'm going to go with, I'm trying to decide how I want to answer this. I like to answer things very honestly. So I'm going to go with the most terrible answer, sort of. Okay, so if you're first, okay, because of course birth is so complicated, right? Okay, if your first is a vaginal delivery, then yes, there's a higher probability you'll have a vaginal delivery. If your first is a C-section, usually it's an auto C-section because, well, you had a C-section, and most people won't do VBACs nowadays. VBAC's a vaginal birth after cesarean section. Now, if you had a hemorrhage, a postpartum hemorrhage after your first delivery, you're more than likely to have a postpartum hemorrhage at a second delivery. After, complications, I was going to say, if there's complications, a lot of those, if you've had it for your first one, you're at a higher risk for the second one. After that, I'm going to say, no, there's no real way to know for sure how it's going to look because there's so many variables involved. Because, for example, a lot of people for their first pregnancy, their first delivery, they'll get induced. But their second one, they'll go into labor naturally. That's a completely different delivery. So just so you know, guys, your cervix is supposed to be long, thick, and closed. My fingers almost perfectly represent a cervix, right? And so this little slit here, that's where the mucus plug lies, okay? Because it can't be completely closed. It's got to dilate. So that's like where the mucus plug is. And so what ends up happening is you dilate and it comes out, and then you have a baby. Now, when you are about to have an induction, a lot of times that means your cervix is not ready. So this actually also kind of feels like what a cervix feels like inside. When we go to feel it, a cervix that's not ready feels kind of like this. And so when your cervix is this firm, it needs a lot of work in order to get ready to be a delivery. So we give you medicines like Cervidil and other things to help to like get the cervix ready so that the contractions will help the dilation process, right? Now, an induction can take 4 or 5 days. Just so you all know, if you have a 4 or 5 day induction, you're lucky, because a lot of docs want to just give you 12 hours, and if you don't deliver, they C-section you. So I think 4-day inductions are fantastic. But if you have an induction, that can last for days, and then your second baby can come along and be born in an hour. So it's kind of hard. After those few basics that I said, is really hard to say what it's going to look like and how well it's like, how similar it's going to be. Because also baby's position is another thing. Are there any risks to having your baby vacuumed out during the birth or afterwards? So, yes. So, babies being vacuumed out, one of the biggest things is cephalohematoma. My gosh, cephalohematoma. So, a cephalohematoma is like this bruising area. So, basically, when they're sucking the baby, they kind of break some blood vessels underneath the scalp, right? And so that kind of builds up there, and that actually then those have to kind of be reabsorbed. And when that gets reabsorbed, it puts the baby at a higher risk actually of jaundice. Sorry, high bilirubin. I had to think about it. So high bilirubin, what happens is babies can't process some of those broken down blood vessels when they're first born. And so it has to go through the liver, and it causes the yellowing of the skin. And that can lead to them needing like Billy lights and other things. So that's one of the biggest risks. Now there's also other risks, including like the shoulder getting caught and stuff like that. That's a lot less common. They shouldn't be doing it more than twice. They should only be trying twice, and then that's it. The other thing is that babies oftentimes will have something called torticollis, which I think I have a video on. But torticollis is basically kind of like a stiff neck where their neck kind of sits to one side or the other. That can happen after a vacuum delivery. It can happen due to poor position in the uterus, all sorts of stuff. Torticollis can interfere with breastfeeding. So it can actually make it harder for a baby to breastfeed because they're uncomfortable, and a lot of times we don't know it. So it's one of those things that has to be, a lot of times lactation consultants will catch it, or a really good pediatrician. But hopefully they don't need to vacuum you if they allow you to dilate. And the other thing is perineal massage can help to get the perineum ready so that hopefully that won't happen. But it is harder in the United States, especially because they put women into positions that aren't natural for labor. Does Pitocin increase a mother's risk of having a C-section? I'm going to go with, yeah. Ooh, you guys are asking good ones. I'm going to go with, I think yes overall. And here's why. Okay. Pitocin has a place during a delivery. If you're not in a regular contraction pattern and you're not contracting strong enough, you're not going to have a baby, because you have your cervix, right? So to dilate, right, the contractions start pulling that cervix. That's dilation. It also effaces it. So this is 0%, this is 100%. So effacing is thinning out the cervix, and then it dilates and you have the baby. You need contractions to do that. That's what the contractions are doing. It's softening, it's dilating, it's effacing to let a baby come out. If your contraction pattern isn't good, you're not going to have that happen. So Pitocin helps when a contraction pattern isn't established. Unfortunately, with inductions, a lot of times we'll do Cervidil and Cytotec to get your cervix ready, but then you're not meant to have a baby yet. Your body's not ready. So we have to do something to start the contractions, and that's Pitocin. So now Pitocin causes this kind of rhythmic pattern of contractions, and that can put some stress on a baby. So one of the reasons why I say it could lead to an increased risk of a C-section is, first of all, the idea that if you needed Pitocin, your body probably wasn't quite ready to go, which is why a 4-day induction is fantastic, because it gives us a lot of time to give you other meds before Pitocin. But the second thing is, if we're using this artificial means of getting a contraction pattern, it's possible that the baby's not going to tolerate that. And then what ends up happening is we need to do a C-section. So I would say that overall, yes. However, some women, Pitocin is what you need. Like that's what gets it going and you're done. So it serves a good purpose. Now, the other thing I want to tell you is Pitocin gets this really bad rep. If you guys are developing a birth plan or anything like that, and I have a video on developing birth plans, and I'm kind of hit or miss on birth plans, guys. Like I do feel it's very important for us to advocate for ourselves. That's why I love doulas, but it's very important to have flexibility. And one of the places that I think there's not a lot of, at first they don't seem to have a lot of flexibility is Pitocin. So everybody just says, no Pitocin. I don't want any Pitocin. We give Pitocin after delivery to help reduce your risk of a postpartum hemorrhage. So as soon as the placenta comes out, your uterus needs to contract down as fast as it can. Because when it contracts down, remember, these are open blood vessels. It contracts down, it clamps those off, they stop bleeding. And if they're left open, you can get a postpartum hemorrhage, right? So Pitocin helps let that uterus start to contract back down. But a lot of people think that because they don't want it for delivery, they don't want it afterwards. And that means that they might be at a higher risk for a hemorrhage. And what people don't realize is the other meds that we give you guys for like hemorrhage, like one of them causes massive, massive diarrhea. I mean, diarrhea, like it is horrible. It is absolutely, absolutely horrible. So it's very important that you understand that that's one of the things that can happen. So it's really important to let that happen. What's the ideal time to wait after giving birth to get pregnant again? The WHO recommends that you wait 2 years after the birth of your baby to start trying again. So you're talking your baby celebrates their second birthday, and then that's the best place. This is the best for a woman's health, okay? It's called baby spacing, and it's best for our bodies. It takes a year to grow a baby. It takes a year to recover. And then it takes another year for everything to kind of settle back into place. Can you speak more to baby's blood pressure in the womb? How they measure this? What might cause the baby in the womb to have high blood pressure? How to treat it? So babies with blood pressure issues are usually having cardiac issues. And that's like a whole thing. We don't measure babies' blood pressures. What we measure is the placenta's pressures. So we can see blood flow on the placenta. If you're having an issue, there's a lot of complications during pregnancy that can cause issues with the placenta, like hypertension, like diabetes. And so what will happen is as the placenta is there, if you have any of these, the placenta can start to fail. And so what we do is we oftentimes, a lot of these women will end up getting admitted to the hospital, and we're keeping them there pregnant, just monitoring very closely until we have to deliver. And we can do ultrasounds that include Doppler flows. And the Doppler studies tell us how well the placenta flow is, as well as the umbilical cord. And so when we have that, we are able to tell how well the flow is to the baby, which gives us an idea of how well the baby is doing. They also do in ultrasound, when they're doing the anatomy scan, they do look at some of the flow of the baby's circulatory system, but we don't actually measure like baby's blood pressure. And so anything that would be cardiac with the baby, they develop a treatment plan and then they deal with that outside. Now, as far as if the placenta is what we're talking about, we try to treat whatever's potentially going to impact the placenta's function, right? Now, one of the things you guys should know is if a woman has high blood pressure, and let's say she gets pregnant and when we finally notice the blood pressure's high, she's been running at 140/80, right? We're not, and then she goes to 160, right? So she was at 140s and she goes to 160. We're only going to try to bring her back down to 140 because if the baby's been used to a placenta functioning at 140 for blood pressure, if we drop it to 120, the pressure is not going to be good for a good blood flow, and that puts the baby at risk. What are the risks to getting pregnant before that 2-year mark? Increased risk of all the complications that you see during pregnancy, increased risk for diabetes, increased risk for hypertension. You have increased risk for hemorrhage, increased risk for I don't know it's an increased risk for miscarriage, but you have an increased risk for preterm labor. It's just basically all of the risks that are associated with having a pregnancy. It's basically because your body needs a chance to heal. And, unfortunately, we're not living in a society nowadays that allows women to rest the way they should rest during pregnancy. And that's part of the other reason why it's so important for us to have the chance to heal. Now, plenty of women get pregnant before that, Natalie. I'm not going to say that it doesn't happen. A lot of OBGYNs will try to encourage a year, but I always think it's very important for women to recognize that it's 2 years. And I'm in psychiatry. I specialize in medicating. I used to be in the hospitals, but I specialize in medicating women who are pregnant and postpartum now with mood disorders. Postpartum depression can happen up to 2 years after birth. So if you can imagine that statistic, it's one of the reasons why you can see it's more than just a couple months and we're back raring to go. How dangerous can it be for a fetus and mama to overconsume various vitamins while adding supplements to your diet? Oh my gosh, such a great question. We have a video on prenatal vitamins, and the answer is it can be very dangerous. In fact, in my prenatal vitamin, I talk about the fact that if you have too much vitamin A, you can actually have serious, serious consequences. I am very holistic, guys. I have patients in my psychiatric practice that only take vitamins. Like, there are vitamins out there that serve a great purpose. And when you're talking about like antibiotic use, I totally believe in probiotics and using that. But there are a lot of vitamins that interact with each other. So let me give you guys an example. I had a mom who wasn't able to, she was going for fertility stuff, and she was coming to me because I was working with like a lot of the mood stuff. And I run a lot of labs. I believe in labs. And one of the things we were noticing was her estrogen was high. And so I was like, what's going on here? Because if your estrogen's too high, you're not going to get pregnant. Your hormones need to be okay. She was taking turmeric. So in case y'all didn't know, turmeric can increase your estrogen levels. Ashwagandha can increase testosterone. That's just two. Black cohosh and blue cohosh, those affect the hormones. So now when you're pregnant, just pregnant alone, your hormones need to be in balance. There's a certain balance to them for a healthy pregnancy. And if they go out of balance, then that can lead to preterm birth or miscarriage. Okay. That's why when women are seeing fertility specialists, their hormones are monitored and checked and tested like all the time, because we know that has to be in a certain range. Then let's talk about some of the other stuff. So magnesium, if you take too much magnesium, it can cause diarrhea. If you all get a lot of diarrhea, that can lead to uterine stimulation, which can lead to preterm birth. It can stimulate contractions. So absolutely over consuming supplements can be a really bad idea. And then let's not talk about the fact that, again, not FDA regulated or monitored. What's in those supplements? You don't know. Like, you don't know for sure. So a lot of people ask me, they're like, what's the best prenatal vitamin? It's the cheapest vitamin out there, guys. It is the cheapest one you can find, because if millions of people are buying that vitamin, and nobody's dying, then that's the one. If it didn't have the right folic acid, we'd know. If it didn't have the right composition, we would know. But all these little organic, like tiny mom and pop shops of like prenatal vitamins, how many people are actually taking that, and what's going on with it? Do you know what's in it? So I definitely think the cheaper vitamins are better, believe it or not. Check out the prenatal vitamin video, because there are a couple things you have to add to it. Like, no prenatal vitamin out there has enough calcium. So that's one of the things. So take a look at the video. But Ramante, that's a great question. And it very likely could, depending on what the supplements are, be a very, very bad combo. And with that, I'm going to close this out. I am Dr. Samantha, the maternity mentor. Thank you for coming for another one of my live Q&A sessions on Mondays at 9 p.m. Eastern Standard Time. Please like and subscribe to the channel. Subscribing to the channel really helps me out and has allowed me to be a part of the YouTube Health platform. If you need anything at all, please feel free to comment on the videos. We look at those. I know we've had a little hiatus on videos. I have some scripts. I haven't been feeling well, so sorry, but they are coming, we promise. And we will try to get some content out for you. But please check out a lot of these videos that my producer has linked into the chat for me. I hope you have a wonderful night. I will see you all next week. Bye for now. I'm Dr. Samantha, the maternity mentor. Have a good one.